Today, we're talking about something that happens to a lot of people: cellulitis on the legs. You get a small cut, a bug bite, or even just dry, cracked skin, and suddenly your lower leg turns red, swollen, warm, and painful. How long does it actually take to heal completely? We're going to answer that question clearly and honestly, step by step. Stick with me because we're going to look at real symptoms, real treatment, what a brand new study discovered about recovery time, who's most at risk, and what can happen if it's left untreated. Let's dive in. Cellulitis is an infection in the deeper layers of the skin. It starts when normal bacteria that live on our skin, usually Staphylococcus or Streptococcus, get inside through a break in the skin. That break can be a cut, an insect bite, or even tiny cracks from dry skin. It can happen anywhere on the body, but the lower legs are the most common spot. When the bacteria get in, your immune system fights back hard. That fight creates the classic signs: a painful rash that looks bright red on lighter skin and dark purple on darker skin, plus swelling and warmth in the area. The usual treatment is simple: antibiotics pills for 5 to 10 days. In more serious cases, doctors may give the antibiotics through an IV in the hospital. Most people start feeling better within just a few days after beginning the antibiotics. The pain eases, the redness starts to calm down. But here's the part that surprises a lot of people. Even after 10 days, the leg can still feel swollen, warm, or sore. Does that mean the antibiotics didn't work? Not at all. Dr. Arash Mostagimi, a dermatologist at Brigham and Women's Hospital and professor at Harvard Medical School, explains it perfectly. Healing has two parts. First part, the antibiotics and your white blood cells kill the bacteria. That usually happens fast. Second part, your immune system was working so hard to fight the infection that it takes extra time to calm down again. That leftover inflammation is why the leg can stay swollen and uncomfortable even after the bacteria are gone. A recent study followed 247 people with mild to moderate cellulitis on the lower leg. They all took antibiotics for 7 to 10 days. By day 10, swelling had gone down by about 50%. The size of the red area had shrunk by around 55%. The inflammation marker in their blood, called C-reactive protein, had dropped to almost normal levels in everyone. Yet more than half of them still felt some discomfort in the leg, and 14% said their pain was 5 or higher out of 10. That's completely normal, especially with leg infections. When you start walking around more, fluid can move back down into the legs, so the area can feel swollen or tender again. Doctors often recommend keeping the leg elevated when you sit, and a warm, moist cloth can also bring comfort. So, who's most likely to get cellulitis? Anyone can, even healthy people with no obvious wound. But the risk is higher if you are overweight, have diabetes, a weakened immune system, poor blood circulation, or chronic swelling in the legs. Skin conditions like eczema or athlete's foot can also create small cracks that let bacteria in more easily. Scratching a bug bite until it bleeds is another way bacteria can enter. What happens if cellulitis is not treated? It can become serious quickly. The rash may spread, blisters can appear, the area gets more painful, lymph nodes swell, and you may develop fever and chills. That's why it's so important to see a doctor right away if you notice these signs. The most important thing to remember, according to Dr. Mostagimi, after you finish your antibiotics, you may still have some swelling or discomfort for a little while longer. That does not mean you need more antibiotics. Just finish the full course your doctor prescribed, keep elevating the leg when you can, and give your body the extra time it needs to finish calming down. You're going to feel much better within a few days, and full comfort usually follows soon after. Thanks for watching. If this video helped you, hit that like button, subscribe so you don't miss the next one, and leave a comment. Have you or someone you know had cellulitis on the legs? How long did it take to feel completely normal again? I read every single comment. See you in the next video. Stay healthy. This video is for informational purposes only and is not a substitute for professional medical advice. Cellulitis can be serious. Always consult a doctor or healthcare professional for proper diagnosis and treatment. Do not ignore symptoms or delay seeking medical help. Your health comes first.